I went to a local NPL Geelong soccer club. This soccer club had a number of senior players injured at the end of last year's season, and they've been carrying these injuries over the break. When the coach asks how they're going, fairly typically, they say, I'm fine, but the coach is not sure and he wants a fantastic season this year. So how can he know the level of injury risk to his players, and what specifically can they do to lower the risk of injury and play to the very highest level they can, especially when the player is inclined to downplay their injury? Our clinic is known for doing this as an injury risk assessment that combines examinations of skeletal structure, joint, muscle and soft tissue function, weight-bearing tests such as lunge, jump, hop and the STAR excursion test, and a balance test using the plantar pressure mat, standing on one leg for 10 seconds with eyes open and then again with eyes shut. Now this last test is really important for players when they're dribbling the soccer ball, trying to take it off an opponent or maintain it for the best chance of a shot. So let's have a look at one such examination. Here we have a soccer player in that position on the mat. From the plantar pressure, we can see that the left foot is pretty stable, even with his eyes shut. But when we tested him on the right foot, with his eyes open, he's fairly stable, but when he shuts his eyes and relies only on his proprioception, he's very unstable and at risk of injury. So what I would do in this circumstance is add J-taping to enhance his proprioception and retest to see if the recording showed an improvement in the right foot. If it did, I'll provide him with the following plan of core strengthening exercises, ankle balance strengthening and stability work, J-taping to be applied for sessions, every practice and game, discuss his choice of soccer boots, and then review this and record this again in 3 weeks and analyse for improvement for modification of the above treatment strategy. And we can show both the player and the coach how important this is, and we can show an improvement. Again, this is something that sports clubs really love, because they actually can see a difference between how they were at the beginning and how they are at the end of a treatment strategy. And maybe, and sometimes it does happen, there's no improvement. So you have to do an intervention of maybe orthotics or a different pair of boots or what have you. But it's all done in an informed way because you're knowing what's going on.